Hey everyone. Today we are going to briefly talk about the definitions of some mental disorders, mental health disorders. And I say briefly because next class there's going to be some information on a project that you guys are going to complete, whether that's individually or you have a option to do that with a partner if you want, but you don't have to. So, like I said, this will be pretty generalized. The first one is an anxiety disorder, generalized anxiety disorder. And when we were talking about anxiety, we actually did dive into this a little bit, as well as some of the other anxiety disorders. Generalized anxiety disorder is severe ongoing anxiety that interferes with daily life and daily activities. A person feels anxious most days, worrying about a lot of different things for a period of 6 months or more. And the 6 months part, it can be under that as well. Social anxiety is a health condition in which social interactions cause irrational anxiety. So somebody gets anxious from being around other people or having to be social. Specific phobias, and there's a ton of different ones. A person will feel fearful and scared about an object or situation, and might go into great lengths to avoid that. For example, having an injection or traveling on a plane. And there are many different types of phobia, but this causes severe anxiety. Panic disorder, also an anxiety disorder, a sudden episode of intense fear or anxiety and physical symptoms based on a perceived threat rather than an imminent danger. Obsessive compulsive disorder, also an anxiety disorder known as OCD, excessive thoughts, obsessions that lead to repetitive behaviors, compulsions. Obsessive compulsive disorder, also known as OCD, also an anxiety disorder, excessive thoughts or obsessions that lead to repetitive behaviors, compulsions. Post-traumatic stress disorder, PTSD, also an anxiety disorder. It is a disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event. Schizophrenia, a disorder that affects a person's ability to think, feel, and behave clearly. And obviously, there's a lot more that goes into that if you've ever heard of that word before, but I don't want to give too much because this is going to be part of a project coming up. Clinical depression, a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. Bipolar, a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Anorexia nervosa, an eating disorder causing people to obsess about weight and what they're eating. Bulimia nervosa, a serious eating disorder marked by binging, followed by methods to avoid weight gain. So binge and purge, throwing up. Dissociative identity disorder, formerly known as multiple personality disorder. It is characterized by the presence of two or more distinct personality states in one person. Attention deficit hyperactivity disorder, and my face is in the way, so there you go. A chronic condition including attention difficulty, hyperactivity, and impulsiveness. And substance addiction, a mental disease that can cause people to have distorted thinking, behavior, and body functions. Changes in the brain's wiring are what cause people to have intense cravings for the drug and make it hard to stop using the drug. So, like I said, I'm not going too far into all of these because there is going to be a project coming up that I will have information for you that you will be able to choose one of these mental health disorders to learn more about and actually create a Google Docs PowerPoint on specifics and going more into what each of these diseases are, what they're caused by, triggers, etc. So you're going to get more information on that shortly coming up.